this short video, we are going to discuss about the screening. What do you mean by screening? Screening is the process of using test on large scale to identify the presence of disease in apparently healthy individual. In this definition, there is two keywords. The first is the screening is the process of using test, and second is it's done in apparently healthy individuals. What does it mean? It is clear tests do not usually establish a diagnosis, rather the presence or absence of identifiable risk factor. As the recipient of screening are usually people who have no illness, it is important that screening itself does not cause any harm. It should be used to identify the high exposure to a risk factor. Type of screening test, each with specific aims, like mass screening done on the large population or subset of the population. Second is targeted screening. Targeted screening is mainly for the specified group of individuals or the people, like in the coal mines workers, like in some workers from the factory, like lead battery factory. Some kind of occupational disease, those who have the risk of occupational disease like pneumococcus, silicosis, vacinosis, bagasosis. So these are the targeted. Third is or multiphasic screening. Several tests are used at the same time. Like these days, screening for the breast cancer is going on in our hospital, in which mainly we use mammography and sonography at the same time. Or opportunistic screening, when people come to a practitioner for some other purpose and accidentally found something different, like someone has done head MRI and found that there is a calcified lesions on some part of the brain, but the patient was no symptoms, with no symptoms. Validity simply can be defined as to differentiate those who have disease and those do not have disease. On the basis of validity, screening test can be understanding the screening test. Please have a look on this 2x2 table. References standard and screening test results. People are assigned to one of 4 cells labeled A through D as shown in the figure, depending on whether they are definitely regarded as having or as not having the target conditions based on the references standard, and whether the screening test yielded a positive results, the person appears to have the conditions, or a negative results, the person appears not have the condition. What is referred to as sensitivity, specificity and predictive value can then be calculated from the number of people in each of the 4 cells. A denotes the true positive, B denotes the false positive, C denotes the false negative, and D the true negative. So the sensitivity can be defined as the probability of a test. So sensitivity can be defined as probability of a positive test in people with the disease. Formula is A upon A plus C. Specificity can be defined as the probability of a negative test in people without the disease. So the formula is D upon B plus D. Positive predictive value is the probability of a person having the disease when the test is positive, A upon A plus B. Negative predictive value is the probability of person not having the disease when the test is negative, D upon C plus D. Enjoyed this video, please hit the subscribe button before you go, and stay connected, stay happy, stay healthy. Thank you.